9 ways to prevent disease and to live your healthiest life. Having good health is more valuable than money. This well-known adage is persuasive because it is based on reality. But what is illness prevention, and how may diseases be stopped in their tracks? To help you live your healthiest, happiest life possible, Medicine Specialist recommends 9 measures you can take to protect yourself from illness and maintain your well-being. 1. Make healthy food choices. According to Dr. Todorov, for excellent health and disease prevention, it is best to create meals at home using simple ingredients rather than purchasing highly processed foods. More than 4 servings of ultra-processed food were linked to a 62% greater hazard for all-cause mortality, according to a study published in 2019. The overall mortality rate increased by 18% for every additional serve. Chronic inflammation, a normal body function gone wrong, can contribute to cardiovascular disease, diabetes, and even cancer, and these foods can trigger it. Types of ultra-processed foods are chips, the simplest of breads, white bread, donuts, cookies, the equivalent of granola or protein bars, cereals to start the day off well, overnight oats in a microwave, creamers for coffee, soda, milkshakes. Dr. Todorov stresses the importance of carefully reading nutrition labels. It's been found that the majority of packaged foods either include more than 5 ingredients or have compounds that are difficult to pronounce. Diet, healthful, sugar-free, and fat-free foods are often deceptive. Find out the commonalities among the healthiest eating plans. Fruits and vegetables, beans and lentils, quinoa, brown rice, and steel-cut oats are all examples of whole foods, as are nuts, seeds, and healthy oils like extra virgin olive oil. Get advice from your doctor or a registered dietitian to help you develop a healthy eating plan. 2. Get your cholesterol checked. Cholesterol levels are reported in terms of milligrams per deciliter when tested. Having your cholesterol levels examined is important because your doctor can give you advice on how to keep them at healthy levels, thereby decreasing your risk of cardiovascular disease and stroke. 3. Check your blood pressure. Have you been diagnosed with hypertension? Do not stop reading even if you find this to be unconvincing. About 45% of U.S. adults have hypertension, as measured by systolic blood pressure, diastolic blood pressure, or are taking medication for hypertension, according to data provided by the Centers for Disease Control and Prevention, CDC. To be considered within the normal range, blood pressure should be less than or equal to 120/80 mm of mercury, mmHg. Leading causes of death in the United States are heart disease and stroke, both of which can be exacerbated by hypertension. The American Heart Association reports that for many overweight persons, losing even a little amount of weight can have a significant impact on controlling or preventing high blood pressure. That may have a significant impact on your health and blood pressure. 4. Get up and get moving. Let go of the idea that you can only exercise in a gym or other regimented setting. The most important factors are repetitions per week, effort exerted, and total time spent on the activity. Dr. Todorov recommends beginning at your current fitness level and working up from there. My own fitness credo is, some is good, but more is better. One common objective is to walk 10,000 steps per day, since this has been found to reduce the risk of developing chronic diseases including diabetes, metabolic syndrome, and cardiovascular disease when coupled with other healthy lifestyle choices. Working out does not have to be done in a continuous block of time. You can walk for 30 to 60 minutes once a day, or you can break it up into 10 to 20-minute sessions multiple times a day. Dr. Todorov said, "Today, we have a plethora of opportunities to engage in physical activity. Use the resources available to you, such as virtual fitness courses, free gym membership trials, movies on YouTube, books from your library, and more. Spending time in nature is enhanced by taking a stroll through a nearby park." 5. Watch your body mass. Dr. Todorov advises his patients to dare to be different from the average American, whose adult population is more likely to be obese than that of any other modern nation. Determine your body mass index to discover if your weight is appropriate for your height, BMI. You are more likely to suffer from cardiovascular disease, high blood pressure, type 2 diabetes, gallstones, breathing difficulties, and several malignancies if you are overweight or obese. Seeking advice from a medical professional or nutritionist can set you on the path to reaching your goal weight. 6. Manage blood sugar levels. Reduce your intake of sugary drinks, candies, and desserts as a preventative measure. Heart, kidney, eye, and nerve damage are all possible complications of diabetes. The American Heart Association recommends learning what causes your blood sugar levels to rise, as well as making changes to your diet, weight, smoking habits, and physical activity levels. Dr. Todorov says, in addition, maintaining healthy levels of blood pressure, blood sugar, and cholesterol reduces your risk for cardiovascular disease. You shouldn't worry as much about getting cancer because of this. 7. Quit smoking. If you are a smoker, quitting is the best decision you can make for your health. The Center for Disease Control and Prevention showed that cigarette users have a higher risk of developing cardiovascular disease, cancer, stroke, and other diseases. Additionally, cancer mortality rates are higher among smokers. Dr. Todorov claims that smokers have a lifespan 10 years shorter than non-smokers. Quitters who are over the age of 40 have a 90% lower risk of dying from tobacco use. 8. Get restful sleep. The quality and duration of our sleep has a significant impact on our health and well-being. Establishing a regular sleep schedule can be helpful if you have difficulties nodding off. Consistently adhering to bedtime and wake-time schedules, as well as eschewing large meals and alcoholic beverages, has been shown to improve sleep quality. Furthermore, it is recommended that all electronic device use be ceased 2 hours prior to bedtime. Dr. Todorov suggests the following as a means of relaxing before bed. Do some form of meditation or attentive thinking. Think back on the day's highlights. Do some reading. Enjoy a soothing cup of chamomile tea. Go through a yoga routine for 10 minutes. Dr. Todorov claims that regular exercise helps his insomnia patients sleep better. Try to rest easy for at least 3 hours before hitting the hay. 9. Don't miss health screenings and vaccinations. It's not an exaggeration to say that being checked out can save your life. They aim to detect cancer and other dangerous conditions at an early stage, when they are easier to cure. Dr. Todorov explains, there are unique screening guidelines for adults and women, as well as different testing according on your family history. Some previous screening suggestions may now be obsolete. Consult your physician for details. Please like, comment, share and subscribe to my channel.